Bioavailability. The same drug, different effect. A patient receives a drug intravenously in the hospital and shows a good therapeutic response. Later, he is switched to the same drug orally, but the oral dose has to be increased to produce a similar effect. Why does the same drug require a different dose when the route of administration changes? The answer is bioavailability. What is bioavailability? Bioavailability, or F, is the fraction of an administered drug that reaches systemic circulation in unchanged form. It determines how much of the active ingredient is actually available at the site of action to produce a therapeutic effect. Here is the formula used to calculate bioavailability, or F. Bioavailability is calculated by dividing the AUC after oral administration by the AUC after intravenous administration and multiplying by 100. AUC, or area under the curve, represents the total drug exposure over time. The IV route is used as the reference because intravenous administration provides 100% bioavailability, or F equals 1, since the entire dose directly reaches systemic circulation. Therefore, the F value tells us what fraction or percentage of the administered oral dose reaches the systemic circulation compared with the IV dose. Key types of bioavailability. There are three key types of bioavailability that we need to distinguish. First, absolute bioavailability compares a drug given by a specific route, such as oral administration, with the IV route, which is taken as the reference with F equal to 1.0. Second, relative bioavailability compares two non-IV formulations, such as a tablet versus a syrup, to compare how effectively they deliver the drug. Finally, bioequivalence means that two drug products, such as a brand and its generic, have a similar rate and extent of absorption, resulting in comparable drug exposure. Factors affecting bioavailability. Several factors can affect the bioavailability of a drug. First-pass metabolism in the liver and gut wall can metabolize part of an orally administered drug before it reaches the systemic circulation, thereby reducing bioavailability. Second, drug factors including lipid solubility, GIT stability, and degree of ionization influence how efficiently the drug is absorbed. Third, pharmaceutical factors such as the dosage form, disintegration, and dissolution rate determine how effectively the drug is released for absorption. Finally, physiological factors including gastric emptying time, intestinal motility, and the presence of food can alter drug absorption and therefore bioavailability. Clinical importance. Bioavailability has several important clinical implications. First, it helps in dose determination because bioavailability determines the dose needed to achieve therapeutic plasma concentration. Second, during an IV to oral switch, lower oral bioavailability may require an adjustment in dose to maintain the same drug exposure. Third, for generic drug approval, the generic product must demonstrate bioequivalence with the reference drug. Finally, bioavailability affects both efficacy and toxicity. Reduced bioavailability may result in treatment failure, whereas increased bioavailability can increase drug exposure and lead to toxicity. Key takeaways. Finally, let's summarize the three key takeaways about bioavailability. First, bioavailability can be estimated by comparing the AUC after oral administration with the AUC after IV administration. The IV route is the 100% reference standard because the entire administered dose directly reaches systemic circulation. Second, first pass metabolism is an important barrier to oral bioavailability. Metabolism in the gut wall and liver can significantly reduce the oral drug reaching systemic circulation. And third, when switching between IV and oral routes, bioavailability must be considered while adjusting the dose because differences in bioavailability can directly affect therapeutic efficacy and safety. Before we finish, try answering these two commonly asked Viva questions on bioavailability. 1. What is bioavailability? Why is it 100% for the IV route? 2. What are the major factors affecting oral bioavailability?